evening to you too.
Silvia, to start with, what prompted, this event, especially the focus on, being the psychological implications of genocide and transgenerational trauma?
Well, this event was actually inspired by our last events that we had in last year, which was actually focusing on educating and raising awareness on the topic, on the genocide of the 1904 to 1908 of the Overherero and the and Nama communities. And we really wanted to involve the youth in the topic. We really want them to also we wanted to make sure that their input and their voices are heard in order to influence the directions and the conversations with regard to the reconciliation process between Namibia and Germany as well.
Sylvia, why are conversations around mental health challenges in affected communities, operative? Why are they operative in today's context?
Yeah, they are actually very important because people that has been affected by genocide, they suffer. The studies has revealed that victims and survivors of genocide, they suffer a lot from mental health challenges, and therefore it was really imperative for us to really start having conversation of what is it that the stakeholders, for example, FES and NID, what are the interventions that we can bring about in order to address the psychological impacts of genocide, which basically refers to mental health issues. How can we really address the effects or the after effects of genocide amongst the affected communities, especially men?
What outcomes is it that you hope to achieve through hosting this three-part dialogue?
Yeah, what we really want to achieve is that we want to see victims and survivors of genocide seeking counseling, seeking help, talking about their mental health issues so that they are able to move forward and find closure. So those are the main important issues that we really want to see. And through that, we also want to see more and more people coming out and talking about their mental health challenges, because if these issues are not addressed, it has really negative consequences on individuals and also the whole communities. Studies has revealed that people that are suffering from mental health issues are likely to commit suicide, or they can also commit violence, especially gender-based violence.
What role do you see for policymakers, Sylvia, as well as educators and mental health professionals in supporting these conversations and initiatives such as this?
Yeah, we actually want them to establish systematic services and programs that focus basically on mental health issues, especially for survivors or victims that has been affected by genocide, wars, and conflicts. And we also want them also to really also increase their support, whether it's financial support or human capital, so that at least there is enough support to deal with the issue of mental health challenges amongst the affected communities.
Silvia, can you share any insight or feedback from previous events that have tackled similar themes?
Yeah, one of the insights that I remember from the previous dialogues that we're having, especially last year, was the emphasis of psychological impacts of genocide, especially trauma. There is a moral obligations that at least the perpetrator should really have that obligation to really support support victims and survivors of genocide by coming up with programs or even funds to really address the impacts, especially trauma and psychological impacts of genocide towards the affected communities and their victims.
Just lastly, Silvia, how do you plan to ensure, that these discussions during this event that starts on Thursday, leads to actionable steps for addressing the challenges faced by the affected communities?
Yeah, what we want to do is through the recommendations, we really want to channel these recommendations to the key players, the Namibian government, the German governments, and also the affected communities, whereby we sort of share with them the recommendations so that they can position themselves and also buy into these recommendations so that they can come up with programs on how to make sure that the recommendations, they do not, they are not just recommendations that are on paper, but these recommendations are being built onto it, and they bring the desired impact. Lives are being restored, their dignities are being restored, and they are able to find closure, and they are being healed, and they are able to move on and build a brighter future for themselves and also for the future generation.
Silvia Mundjiindi, we thank you so much for joining us here on the Daily Roundup this evening. Thank you for your time.
Thank you very much for having me. Bye.
Well, that was Silvia Mundjiindi, Project Manager from the FES, speaking to us there via Zoom. Moving on to health matters, this week's Healthy Living focuses on the use of artificial intelligence to improve healthcare, plus a look at a new gene therapy that health experts say has the potential to revolutionize the treatment of sickle cell disease. Let's have a look.
Regulators approved 2 new gene therapies for sickle cell disease that doctors hope can cure the painful, inherited blood disorder that afflicts mostly Black people in the United States. The Food and Drug Administration said the one-time treatment can be used for patients 12 and older with severe forms of the disease.
I think this announcement of the approval of gene therapy is potentially game-changing for a number of patients. Many patients lack the availability to do a stem cell transplant. And so for those patients, it often means a life filled with pain and with repeated hospitalizations and lots of complications. And this potentially offers a chance to alleviate those.
The disease affects hemoglobin, the protein in red blood cells that carries oxygen. A genetic mutation causes the cells to become sickle or crescent-shaped, which can block blood flow, cause excruciating pain, organ damage, strokes, or other problems.
I know for someone like myself who goes through red cell exchanges once every 7 to 8 weeks, this one-time kind of care, I think, is very, very much so needed. It, again, for someone like me, cuts down having to go to the hospital every month into doing this treatment and then just getting regularly checked by my doctor. So I think it's something that's really needed for this sickle cell community.
Current treatments include medication and blood transfusions. The only permanent solution is a bone marrow transplant, which must come from a closely matched donor without the disease and brings a risk of rejection.
I think this is a giant leap forward in gene therapy for treatment of chronic diseases. And so this is the first step forward. And I think in the future, we're going to see a lot more diseases that are able to be treated with gene therapy.
The Vertex treatment was recently authorized in Britain and Bahrain and is currently under review elsewhere.
Dr. Remigius Rugakengila is a urologist at Benjamin Mpaka Hospital in Dodoma, Tanzania. He discusses how artificial intelligence will impact healthcare in the future.
I can predict maybe near future we are going to have better health because of artificial intelligence. It's not going to replace human brain, rather than it's going to complement the human brain. And with machines, things will be easy. Human beings are the one who are going to command the machine. We are the one who are going to calibrate the machines. So I'm not worrying with the machines. Actually, without those machines, we had a problem. There was a lot of errors. Actually, with machines, we've minimized a lot of errors, and we've done a lot of work with with minimal time. I can say all the people, all the system are benefiting, because for doctors with artificial intelligence, you do a lot of operation in the minimal time, and at the same time, you don't get tired. And also patients, rather than staying in the hospital for 2-3 days, with artificial intelligence, you can just capture a disease, early diagnosis, and you can treat you. So you can imagine, it's a chain. All people are benefiting. Even the government is benefiting. I can tell you, with artificial intelligence, with our good high-tech machines, we can help all the people global. What we need is the goodwill of the government and the goodwill of those people who are producing. For example, using WhatsApp or using high-tech machine, you can just even give directive when you are in another country to the terminal area. If they have a good access of internet, they have a phone, you can give directive and you can reach them. For another thing, if a person needs blood, for example, you can use a drone to deliver blood to that area. You have seen that in recently, I think it's China, whereby they were doing robotic surgery in a distance. So maybe in the future, when we have trained our people how to operate, how to go with that, to work with machines, so then I can see we can treat many patients at short time of period.
Well, that was our Health Matters for this evening. Let's take a brief break. We'll be back after.